Evening, ladies and gentlemen, Barbadians at home and abroad, friends. This evening is another in our series, Beating Back the COVID Challenge. I know that this evening we had indicated that we would discuss the vaccine, but the reality is that in view of continuing concerns expressed by members of the public, both here and abroad, we are going to attempt to further explain what the government is doing to address the challenges being faced at this time. In order to do that, our very special guests this evening are Lieutenant Colonel the Honorable Jeffrey Bostick, Minister of Health and Wellness, Dr. Anton Best, Public Health Specialist in the Ministry of Health and Wellness, Dr. Corey Ford, who is an infectious diseases specialist and is responsible for care in Barbados, COVID care, and specifically for the Harrison Point facility. Also with us this evening, we are honored to have the Prime Minister of Barbados, the Honorable Mia Mottley, who will speak on behalf of the government of Barbados and outline its broad approaches to addressing what the challenges have been and exactly what the government is doing to address them. We will start first with Minister Bostick, who I believe is going to give us the current numbers as well as outline some new policy prescriptions that are being proposed. Minister Bostick will be followed by Doctors Best and Ford, who will speak to the policy from the scientific and management perspective, and then we will hear from Prime Minister Mottley. Lieutenant Colonel Bostick, good evening and welcome to you, Minister. Please address us. I still greet you from my position in quarantine, but I'm happy to see you, sir.
Thank you very much, Ambassador Thompson. Good evening, Barbadians at home and abroad, residents of Barbados, ladies and gentlemen. I am here this evening to give an update as to where we are in our COVID effort so that you would have some of the information which you have been requesting. You would keep abreast of what is happening with our fight and to give the assurance that everything is being done to deal with this particular problem. The teams have been out continuously in the field, and I compliment those who are doing the contact tracing, the staff in the polyclinics and the testing centers, and they have been producing some statistics and some results for us that we are utilizing in terms of how we chart the course forward. We've seen some improvements in the lab, and the Prime Minister, the Honorable Prime Minister, will speak to those issues. But I would like to start first of all by indicating to you that out of 1,429 tests that were processed by the lab, that there are now 29 new positives, 29 comprising 21 males and 8 females. 12 of those positives are from Her Majesty's Prison Dodds, including 1 female staff member, 4 males, and 7 male inmates. 3 of the new cases are persons who would have been sent to Harrison Point Isolation Facility for assessment, and they have been confirmed as positive. And I'm also, let me say that 28 of the persons from the isolation facility will be released today. Now, out of the remaining 12 cases from this number of 29, there are 8 Barbadians and 4 non-nationals, 8 Barbadians, 4 non-nationals. We also have another 49 results that are pending today. And this is a daily occurrence, and you will find that some of the positives for the following day would have resulted from some of the cases that have been pending. The situation at Her Majesty's Prison Dodds, there's now 309 confirmed cases, 309, with 70 staff members, 45 males, 25 females, and 239 inmates, all male. We would have been asked a question in relation to the psychiatric hospital, and I can say today that we have 22 persons who were tested and all tested negative, with another 12 persons awaiting results. Over the last day or so, the contact tracing team would have been out, and we would have received some additional figures from that team. For the most part, the clusters, there have been some changes, slight in a few instances, about 10 or so in one instance. So that I can say to you that for the South Coast cluster, we're still with 4 positives. The bus crawl, 17, and the catamaran cruises, 7, and the West Coast cluster is now at about 100 positives. I would have indicated during the last conference that we had 3 persons from a church in the north. That number is now 4 males, and we can confirm that one of the positive persons is a close relative of someone who was involved in the West Coast cluster. In terms of this West Coast cluster, West Coast Bar 1 now has 35 persons who are positive, 18 males, 17 females. West Coast Bar 2, 34, 14 males, 20 females. The Paradise Beach Line, 20, 14 males, 6 females. West Coast Restaurant number 1, 17, 10 males, 7 females. West Coast Restaurant number 2, 5, 2 males, 3 females. And West Coast Hotel, 5, all 5 males. We would have said to you before that we are going to start to give you a breakdown as to some of the results as a result of the contact tracing. And I had indicated that because of this process, it is not possible to give results for today, because we have to await the reports coming from the field. So we have undertaken to provide statistics for you at least twice a week that will indicate a number of cases. So that if we look at the first 100 cases out of this current outbreak, and these cases would not include cases from Her Majesty's prison. So 100 cases, there were 35 male, 65 female. Out of those, 4 males were from the second test, 2 male, 2 female, with one of those persons being a Barbadian. There's 96 persons from local transmission in connection with some of the clusters. Males 33, females 63, with 88 of those being Barbadian residents. 94 of the 100 cases have been asymptomatic, and naturally the other 6 have had symptoms. And to give you an idea as to the age range that we're looking at here, because this was a question also that was posed to us a couple of days ago, there were 5 persons who tested positive from that 100 who are under the age of 10, 5 under 10. There are 12 between 11 and 20, 23 between 21 and 30, 30 between 31 and 40, 18 between 41 and 50, 11 between 51 and 60, and there was 1 person between 61 and 70. So those are the figures that I can provide you with today. In terms of our dealing with the situation in the quarantine facilities, there's some decisions that we took today utilizing the guidelines provided by the World Health Organization, PAHO, especially in relation to the situation which confronts us at this time. And Doctors Best and Ford will go into those details, and then they will be followed by the Prime Minister. Thank you.
Very much, Minister. We very much appreciate this kind of detailed breakdown because of data, because this is what the public wants to hear in order for confidence and trust to be built. I hope that we will continue to have that data as you have indicated. Thank you very much. There has been a new policy, you said, and we are now going to ask Dr. Best if he would be kind enough to explain to us, please, what this new policy is, how it will be implemented and rolled out. And I may have a follow-up question if, in fact, I think that we need a little further clarification for the public. But we really want to understand the policy and what the government is doing, how it will be implemented and rolled out. Dr. Best, please. Thank you for coming and welcome to the microphone.
Good afternoon, Ambassador Thompson. Thank you very much to all persons watching and listening to this broadcast. I want to start off by first explaining the quarantine period for the SARS coronavirus 2, which is responsible for COVID-19 disease. The incubation period of this particular virus is 1 to 14 days, so a maximum of 14 days. And the incubation period is defined as the time from exposure to the manifestation of disease. So from the time a person has come in contact with somebody with coronavirus or COVID-19 to the time that they actually manifest it, if in fact they've become infected with it. So what we try to do, we apply that knowledge of the incubation period to match quarantine. And quarantine is essentially defined as keeping a person away from interacting with other persons in the event that they really did get the disease. This is a standard thing, and this is well documented throughout all of public health, and as advised by the World Health Organization and other health authorities such as the US Centers for Disease Control and Prevention. So we've applied the 14-day quarantine period in many circumstances, and you can apply it in all circumstances. We can also modify it. And what do I mean by modifying it? If you're able to do a test at some point, you can actually reduce the quarantine for. So the quarantine that I mentioned of a full 14 days does not take into consideration doing a test. So you can reduce the length of quarantine if you introduce a diagnostic test for COVID-19. What we have decided to do is we look at those persons who've been in quarantine for 14 days, and once you've hit and completed that 14th day, you no longer need to be in quarantine. We can look at a handful of persons who have made it to 10 days, but not quite 14. The likelihood of them having the disease is still there, but you can do a test, a rapid test technology, or if you have available diagnostic tests. You can also couple that with doing a clinical assessment. You can ask the person if they have any symptoms or signs of COVID-19 and make a clinical determination that this person does not have the disease based on those factors. And that is what we have recommended as a Ministry of Health to the Cabinet. And that is what we will be doing in a handful of circumstances. I also wanted to take the opportunity to mention that the Ministry of Health has recommended to the Cabinet extending the period of lockdown, and we frequently refer to it as a quarantine period, but essentially what we are trying to accomplish here are two things. We're trying to reduce the amount of social interactions that people are having, and that is why we've asked for that. We also need to give ourselves time to implement and to complete as best as possible the contact tracing efforts that we have started at the beginning of this outbreak. Thank you.
Thank you very much, Dr. Best, for that very comprehensive explanation. Dr. Corey Ford is the infectious disease specialist and therefore responsible for Harsom Point and for CARE. I'm going to ask Dr. Ford to further elaborate on the information that we're hearing and the implementation and rollout of this policy as it now relates to people who may be in quarantine. Thank you.
Good evening, Barbadians and guests. I just want to, before I start or give a talk about that, I just want to give you a quick update on what's going on in the isolation facilities. Currently, we have patients there between the age of 24 and 80 in our primary isolation area, which is the area I think of most interest to most Barbadians. In that area, we have 3 individuals who are currently on oxygen. And remember, the last time I spoke to, we had way more than that. So we had some improvement, we had some discharges. And one of them still remains that Barbadian male of interest, which I talked before. He's still in a moderate to severe state in terms of his disease. Additionally to that, to the facility, we added one more interesting case I'd like to let you know about. And this is a Trinidadian national who has kidney disease. She has had a transplantation of a kidney in the past or early last year and is presented to us with COVID. So we're watching her quite carefully. And of course, in that facility, we have the capacity to do dialysis. And this is one of the things we've been discussing, certainly with nephrologists on site. In our facility, at the primary isolation area of interest as well, is one pregnant female, about 33 weeks pregnant. She's actually quite well. And we actually admitted her there to that area really as a real precaution more than anything else. And she's being followed by the obstetricians and has been from the beginning. Additionally, in our other facilities, in our Blackman Gauntlet facility, we had one transfer back to the Harson Point facility, a middle-aged guy, Barbadian, who felt unwell, and we just took the precaution of transporting there. I will say that he's currently stable. At our prison facility, I have some good news for you this evening. If all things, knock on wood, turn out like the way we want them to, we should have up to about 73 discharges tomorrow from our prison population, and that really, for me, would be great. So getting back to exactly the conversation here, our discussion here of importance, I just want to walk you through very slowly and very carefully a little bit about COVID. I know you've been, I use the word sometimes COVIDized. So there's a lot of discussion about what COVID is, days, how can you get the disease, etc. But to be specific as it relates to the policy, I just want to walk you through a few things and then bear that on what's going on internationally. So very few basic facts, which I know all of you know out there. So that fact is this: the incubation period for COVID as we know it is 14 days. That's well known. At the start of the outbreak, most countries were putting people in quarantine for 14 days. But I think one of the things we have to understand is as we go on, this is now being just past a year of COVID. So it's quite interesting that we learn as we go along, and things will obviously change as that particular piece of information increases. So a few things we learned and very quickly. If I talked to you and I spoke to you about 3 months ago, I would have told you, hey, one, asymptomatic people don't spread the disease at that point of time. We thought that, but we learned more information about that. So why is that important in terms of the current discussion? So we know the incubation period is 14 days in general. And we also know what the current policy in country is, which is that 72-hour window test before entry into the country. So we all know that people entering the country. We also now know a few other facts. So within a few months, maybe 4 or 5 months ago, we learned that we changed our diagnostic criteria from having 2 negative screens to be released from isolation. We know that really was a difficult thing. And there were many Barbadians who spent long periods of time in isolation. But we've learned, certainly from studies coming out of Asia, which were very good, which changed the scope and landscape for what we do. And that was simply this: make it really, really simple. People who get COVID, in terms of the capacity to spread the disease, we know when you're past day 10, you really can't spread the disease to any extent. Okay, so this is an important fact because it then leads us to make one clear decision. and that is that people are released from isolation at day 10 once you remain asymptomatic, and this is important, right? So day 10 of up to day 10 of isolation, and then you go out of isolation, on day 11. For those persons who have symptoms, is quite different. So if you have symptoms out there in the presence of COVID, your time period basically is a minimum of 14 days. If you really get up to day 11, is then 3 days, after that, that we will let you out. So if you wind it back to what we're talking about right now, making it really, really simple. So if a person comes to Barbados with a 72-hour window test, and they've been in Barbados for 14 days, as is being done in Canada right now. And Canada, I'll tell you, Barbados was way ahead in terms of some of the protocols, because they're not implementing the protocol that we had in place for months, which is that 72-hour window test. Canada's decided, look, if you're in for the country for 14 days, you're not required to have a test, and you stay for 14 days. The US has also looked at it as well, and the Centers for Disease Control, as Dr. Bess has said, which is quite interesting. Now, that isn't the case in Canada, where you don't get a test, and at day 14, you're released from quarantine. So what are we doing in Barbados, and what system now that we're looking at in this particular situation on a patient-by-patient scenario? So in a scenario where things are backed up in the lab, and I always talk to you before, as a general public, and tell you this, we have to try to adapt to scenarios, but also follow the science. If you don't follow the science, you're going to get in trouble. So we, in everything we do, we really try as hard as possible to follow the science. Like I said, for me, it's about medicine, and my discussion with you is always about medicine and nothing else. So in this particular case, people who are now day 10, we know I just told you before that we discharge people at day 10 who are asymptomatic. So the key in our point is to really say to ourselves, look, how else can we mitigate that other part of this strategy and not going to day 14? So we implemented a test, and that test is going to be a rapid antigen test. And I've used it. In fact, I've used it last night on a patient. Pretty good test there. So we're able to, really risk stratify and bring that risk down in terms of releasing persons at that point with a test in place, knowing that other countries who are going day 14, they're going day 14 because they're not doing a test. So you're sure when that person is discharged, and you get your nice piece of certificate from the Ministry of Health that person is safe to reintegrate back into the community. Bearing in mind, I start off by telling you, we have learned that even if you become infected with COVID, sometime, I said 8.1 went up to 10, you really can't spread the disease. So this is a very important fact and a very important piece of information to understand. So your question, going back as I finish off, is when does a person who becomes in contact with an individual, when does that individual actually have the risk to spread the disease, or when do they actually convert to positive? And simple, what I mean by that is when you go from a negative test to a positive test. So the majority of people in the population will go somewhere between day 4 to day 6. Most people, day 4, day 5. So if you work that out and then work on the other period which I mentioned, and then you add a test to that, really honestly, putting that person back into the community is fine. And there's really no significant challenges at all with that in terms of spreading the community. So I think I hope I've been simple enough in explaining this to you. And it's a strategy that not only we use in Barbados, it's not something we pull out of space. It's just following the science, and then additionally following the science in terms of what other people are doing in other countries. And I always say that I think we need to be sometimes, we have good people here among the Ministry of Health guys, and they look at all of these different entities. And I know there's been discussion with PAHO, WHO on this, but I think we have been super cautious, extra cautious in adding that other test at the end for another level of safety. I think every single boundary becomes important. Thank you. Have a good evening. Bye.
Thank you, Dr. Ford, for that very detailed information. This evening, as I indicated to viewers, we've had the Minister of Health and medical professionals, and now we turn to the Prime Minister Motley. Welcome, and maybe hear from you, please.
Thank you very much, Ambassador Thompson. Good afternoon to all Barbadians and all visiting us. I want to thank you for the opportunity to be able to address you yet again. The last time on which we spoke last Friday, I did promise you that I would be in regular contact and seek to address the country on a number of issues. And over the course of the last 6 days, a number of things have happened that I believe that I have a responsibility to be able to talk to the country about and to talk through some of the rationale behind it so that we're all on the same page. I want, first of all, to say that I am happy that Minister of Health has had, over the course of this week, we can see a definite improvement in the trajectory so far. And it is against that background that when the Ministry of Health and the public health officials, as Dr. Best pointed out just now, requested an extension to the restricted movement to the 31st of January, we have readily agreed to it because we believe that we have seen the benefits of the restricted movement between the 31st of December and the 14th of January today, and that we will continue to see the benefits, and therefore I think it was a legitimate and well-argued request, and as a result the government agreed yesterday to the extension of that restricted movement until the 31st of January. I know that for some it is difficult. I know that for some it is inconvenient. I know that for some it requires sacrifice. And we are appreciative of it. But as I've said from the very day this house started, we are all in this together. And to that extent, therefore, it is critical that we continue to adhere to the requests of all. We adhere to the restricted movement from 9 p.m. until 5 a.m. in the morning, only those with the appropriate passes or indeed those from essential services, as has happened for the last 2 weeks. By the same token, we've kept all of the other arrangements in place. Just last week, we had arranged and included in the directive that mask wearing in all buildings inside, all public buildings inside would be mandatory, as well as public transport, with the exception of if you are making speeches and you have physical distance around you, or if you're drinking or eating or taking medication, or if for whatever reason there's a medical reason that you can't do it. I saw a video this week that really reinforced in me why this is important, and I've actually asked the officials to see if we can continue to share, because we've been sharing so many things, regrettably, across the country that are not rooted in facts, and I'll come to that a little later in my address to you, that where we do have information that can help ordinary Barbadians and to understand why the mask is so important, then we need to be able to do that. I also wanted to explain why we went to the 31st in terms of understanding that, look, we are not yet at the end of the road with COVID. We are working hard, and because of the presence of vaccines, as we've said before, we can see light at the end of the tunnel. But there must be an acceptance that we can live with this thing and we can manage it as we were doing, but we will have to be a little more careful and a little more disciplined. What does it mean? It means that a lot of the things that we would love to do in terms of large social gatherings, as Dr. Best told us earlier, will be difficult. It does mean that there will be some disruption to, for example, persons who want to fet or persons who want to lime in large numbers. But there are other things that we can do in the interim that can still bring us joy. In small bubbles, we've tried to keep physical exercise and beaches there for persons, largely because they're outdoors and the air is moving. Those things can help. But at the same time, until we can get the 60% of our population vaccinated and to get some level of herd immunity, we are going to have adjustments to how we live. It's not forever, by any stretch of the imagination. But for now, we can do this. We have been doing it. We did it for a couple months last year. We have done it for the last 2 weeks. I'm confident we can do it for the next 2 weeks. And as usual, we will consult then with the public health officials at the end of January. But if the numbers keep going in the current trajectory, then I believe that we can continue to be able to allow for more responsible action and responsible movement without necessarily having the levels of restrictions that we currently have. So work with us, we'll work together, and we can turn this around. As it relates to what we discussed last week with the introduction of a new system and the reduction of a backlog, I took direct responsibility over the last few days of ensuring that the lab and the testing centers were pressed into action with what they needed. And let us be clear, this has not been our finest hour as a nation. We know that. But by the same token, I believe that we've still been able to hold the center. We had an explosion of test requests across the country, as was expected, because of the anxiety of ordinary Barbadians with respect to the levels of exposure. Over the course of the first few days, the Chief Medical Officer issued a statement as to the kinds of criteria to be used in determining who should be given priority in testing. And he made it clear, and I think Dr. Best and Dr. Ford and Dr. George have all said, that simply being in a room with a person with COVID does not give us the virus. And we've said it over and over, and we will continue to explain why. The mask reduces our possibility of catching it. Our sanitizing reduces the possibility that if we have it on our hands, we will pair it to our eyes, our nose, our mouth. With respect to the physical distancing, it ensures that when we speak, anything that comes out of our mouth will unlikely come to the next person if they are wearing a mask and if we're physical distancing. So we get that. But what we want to be able to do now is also to ensure that as we address the tests, that we are in a position to do so in a manner that made sense. Last week, therefore, after that explosion of tests, we agreed to the introduction of new categories, categories 1, 2, 3, and 4, focusing primarily on primary contacts, national security and frontline medical persons, elective surgeries and medical procedures, elderly persons, prisoners, prison wardens, etc., in category 1. And category 2 was supposedly visitors, but over the course of the last week, because of the introduction of similar 72-hour tests now being required for persons traveling to the United States of America, the United Kingdom, and Canada, of course, we now have additional obligations upon us for testing, and hence category 2 became inbound and outbound tourists, inbound and outbound visitors, and Barbadians who obviously, for whatever reason, are seeking to move to or go to those other countries. We are in the process of analyzing what the requirements are. In some instances, yes, it is live and applicable in Canada. With respect to the United Kingdom and the United States of America, those conditions are not yet in place, but shall be. And we will have the appropriate test, because in the case of the United States of America, for example, they don't require the gold standard PCR test, which we use typically here in Barbados, but they require some other form, or they will accept, I should say, some other form of rapid test, whether it be rapid PCR or rapid antigen. In those circumstances, we have had in our analysis of our capacity nationally to take all of these things into consideration. I'm happy to report that our decision to separate current and backlog has paid dividends. Indeed, I can report to you, and let me be clear for those who may want to create mischief or who may want to say the numbers don't equate. The numbers which I'm giving you are not the numbers of results every day, because a result is made up not just of the previous day, but it may be made up of tests done on previous days before, and hence it's a cumulative figure that sometimes may be larger. But on Monday, when we introduced this new system, Monday, January the 11th, the labs and the polyclinics collectively tested, and the private sector, 908 persons. And the Best Dos Santos lab has already completed results for 720 of those 908. Bear in mind that the requirement for the first 24 hours is category 1, and the next 24 to 36 category 2. So they're very much still within the band of acceptability on the majority of them. And with respect to the shortfall that we have been having to tweak and improve the collection of data at the time of the collection of tests. And that has been one of the problems that I'll address shortly when we come to the backlog. With respect to January 12th, 1,208 tests, that is 2 days ago. Those test results would have been delivered the night time of Tuesday, so that those really were only run from yesterday, and they've already completed 690, and as we speak, they're continuing to run the remaining of the tests, and we expect the majority of those tests to be completed by tonight. The 13th, yesterday, last night, we received 1,058, and we've already completed 266 of the Category 1 tests on January 13th data, and therefore they will be continuing with January 12th and January 13th in that one particular lab. We have literally isolated one lab to keep current and another lab to be able to deal with the backlog. And we actually have 3 machines running, 2 in the backlog lab and 1 in the current lab. So with respect to the backlog, we are in a position between January 7th and 11th where we still have just over about 3,000 tests to be completed with respect to the backlog. The best advice being given to us from the head of the lab, and I accept it, having seen and been working with them every day for the last few days, is that we should be able to clear the majority of the backlog for which we have genuine information between now and the end of the weekend. Beyond that, there were some samples for which there were difficulties, as I think I adverted to last Friday, that there just simply was not information, either because it was illegible, it was smudged, or the difficulties with the transmission of data because of what was happening with the SHAPE app and connectivity and DNS issues. For those persons, many of them were asked over the course of the last few days to be retested, and in many instances, many of them have already received their new results and have been released in most instances, with a handful, I think, being positive. With respect to that backlog, and let me give you, for example, from the 7th of January onwards, and I'm treating to the 7th to the 10th, because we're going to apply the new policy that Dr. Bess and the others adverted to for anything before the 7th of January. The 7th of January, we would have received 2,154 tests, and this is to give you an example. Right now, we're taking 900 and 1,000 tests this week. Before this whole thing, we were taking 400, 500, 600, 700, 800. So that we were last week taking 2,000, 2,500 a day. On the 7th of January, we received 2,154 tests, and we have already completed 1,717 results for that day. For the 8th of January, we received 2,786 tests, and we have already completed 1,278 in that backlog. On the 9th of January, we received 1,384 tests, and we've completed only 414, and on the 10th of January, 1,165 tests were received, and we have completed 213. If you can see by the numbers of tests, you will begin to understand, therefore, that what this country faced last week was a veritable explosion between the 31st of December and the 10th of January, not even the 10th so much, more the 9th of January, a veritable explosion in the numbers of tests that even with the best will in the world would have placed strain on any system. It was an operational failure not because we don't have a number of machines, but because we did not have the capacity to deal with that large numbers of tests within the short period of time, especially over the holiday period. Fortunately, we have been able, as I said last Friday, to increase the numbers of persons both working in the lab as well as communicating the results. We have been able to expand the call center significantly. We've also been able to have different departments coming together to help us be able to identify the categories 1, 2, 3, and 4, especially in the backlog, given the fact that the new system was only implemented going forward from the 11th of January, because when we announced it on the night of the 8th, as you would appreciate, it would have been difficult for the polyclinics to implement it before the Monday morning, since they are the primary locations for the tests. I am satisfied, my friends, that we are on our way towards getting there. We are not quite there yet. And that is why I've said that we will continue to update you, because as in all things, I have promised you full transparency and accountability. I am also comfortable that the lab staff and the additional doctors and additional lab people who have been brought in are working beyond the call of duty to do that which is necessary to be able to report and to give back persons the results that they need. We also have, as I indicated, I think earlier this week, that in addition, a virologist from PAHO is likely to be coming in to do additional training of the lab technicians. I spoke to the additional assistance that we will receive from the Cuban government. The Minister of Foreign Affairs has advanced that work considerably, and I expect at some point over the course of the next week or so that we will begin to receive the benefit of those persons. Let me say that we are not just bringing in people for the sake of it, but one of the things that became clear to me very early on is that we have to build redundancy. Look at Dr. Bess here. He hasn't had a day off in God knows how long, but he has a family. Minister Bostic, the same thing. And I can go through the head of the lab, the same thing. So that when we bring in persons, it's not just simply because we don't have persons, we have people. But if you don't give people the opportunity to rotate in and out, we're going to have burnout. And in fact, I feel it very often as well. We're going to have burnout, and that's not going to give us the kind of results that we want. So that as with all other things, what we are doing is planning not just on the basis of the existing resources that we have, but the additional persons that are needed in order to allow our people to rotate in and out in a comfortable way so that we can run the marathon and not believe that it is a sprint that is required of us. With respect, therefore, to the backlog, I expect that the results between January 7th and 10th hopefully will be cleared by the end of this weekend while continuing to be current. And follow the logic. Once that backlog is finished, it means that we should be more than comfortable with the resources that we have there and with the application of all three machines now just to remain in current, as well as dealing with the additional burden now of the requirements for persons leaving Barbados to carry tests with them. I can report to you, however, that in addition to that, we have had discussions with one private sector entity who is well advanced in establishing another lab facility and with another one who has been discussing it. The last occasion on which we met, I told you we were speaking to the Chinese about a mobile lab. Minister Walker has since reported that that mobile lab would not be available before the middle of the year at best, and that cannot help us with our immediate short to medium term issues. And as a result, there are some tests which we had received from the Israelis a few months ago, which have been, we spoke to them a few months ago, but we received the briefcases within the last couple of weeks. We do have a new person who has volunteered as a virologist to come into the lab, and we are seeking to validate those mobile briefcases. If they are validated and work well, I think the original authentication came from the Pasteur Institute in Israel, but if they work well for us, it will allow us to do exactly the same thing that the mobile labs would have given us the ability to do, and therefore it is critical that we await those results over the course of the next few days. In addition to another form of technology that the lab was looking at, which I'm told is called LAMP technology. These matters are a little too high for me, as you would appreciate sometimes, but I'm sharing them as they have been shared with me. And I'm satisfied that the combination of those things, along with the analysis of what countries require in terms of incoming travelers, will allow us to be able to appropriately manage and roll out these things without the disruption that we have seen in the last week. As I said, it is not our finest hour, but I do believe that we have learned from it, and I do believe that we can continue to do better. And I can assure you that I have insisted, and a number of ministers have literally carried the weight this week with us. Minister Bostic has been there at the forefront as usual, Minister Walcott and the rest of the Cabinet Subcommittee, the Attorney General, and of course the Minister of Tourism, who has been working flat out, working to help our visitors who in many instances have been some of the victims. Not just visitors who are not born out here, by the way, but Bajan visitors, people who are born in Barbados, people who are born in the Caribbean. Which brings me to the point that we wanted to make, that Dr. Bess spoke about with respect to the 14-day period. And the doctors, I leave the doctors always to speak to the science. But what we did, as you heard from both Drs. Bess and Ford, is that rather than simply relying on the 14-day effluxion of time, which is used by every country in the world, we took a decision that out of an abundance of caution, because of the smallness of Barbados, because of the density of Barbados, that we would also impose then a requirement for clinical assessment as well as for the use of a rapid antigen test. We believe that when delivered starting from tomorrow going forward, for persons anywhere between 10 and 13 days since being here, since receiving the test, because remember, in many instances, some would have had tests 5 days before, that this is more than comfortable, because since their first negative, it would more than 14 days would have elapsed, but by the same token, we would also have the comfort, hopefully, of a negative result from the rapid antigen test. Obviously, if the result is positive, then Doctors Best and Ford have indicated that those persons would then be required to take a PCR test for further validation and for further assessment of how they will be treated. With respect now to those areas of tests, we will continue to keep the country updated, not just through myself, but through the other officials speaking. But I hope that this brings a sense of clarity. And believe you me, people have worked, these labs have worked around the clock, 24 hours, 7 days a week. And I know it because I've been visiting them. I've been making sure that the spirits of the team are up. Where we've had to throw in and put in the additional resources, we've all done it. There is no territoriality in this. This is our country, and we have a responsibility to deliver these results as far as possible, even though, in some instances, as I said, regrettably, the quality of some of the initial things that were taken, information that was taken, has left the lab in a position where they could not even determine what they could do with some of those, and hence the need to retest some of the people. And for that, we regret. Now, I want to address this issue that clearly exploded in the minds of some with respect to the decision taken by the government of Barbados with respect to persons, and not just tourists, persons who are staying in quarantine hotels and who were waiting more than 72 hours for results. You know, I'm 55 years old, and I'm a Bajan through and through. And for my 55 years, everywhere you go in this country, there's always been one thing that I've always understood to be intrinsic as Bajan. It is as Bajan as cuckoo and flying fish. And what is that? When a Bajan goes in a shop or a store or goes for service or to a restaurant, and they pay the good money for something, or they ask for something, and what they get is not what they sought to buy, what is the first thing a Bajan is asked for? It's not refund, it's satisfaction. And that satisfaction can come in many forms. And it's a word that we know well. Bajans want satisfaction. A person listening to me from outside may not understand what I'm talking about, but you and I know what I'm talking about. Now, if satisfaction is good enough for each and every one of us, how do we believe that the very thing that one predominantly, yes, visitors from overseas, but visitors from Bajans returning home to see family at Christmas, Caribbean people passing through here or coming to see people, how do we believe that we know that we have done something that falls short of what it should, and that we should just turn our face away and do not offer any form of satisfaction? That's not the school that I was brought up in, that's not the Barbados that I know, and that's not the person that I am. And I regret to say that I don't believe that the majority of Barbadians who heard, or let me put it another way, the majority of people who heard people could even want to believe that we could do something that falls short and just turn our backs on people, especially in circumstances where in many instances those persons would not have budgeted nor would not have the funds to be able to pay. The thought of hotels having and hoteliers having to have a crisis of conscience as to whether they go to the police or whether they write off and don't accept the fact or accept the fact that they will not get paid for that night or those nights is something that would not work well, especially if you have to turn around and then pay the workers and to pay everyone else. We are going to have a discussion about how we deal with visitors. And you know, the most common thing said about Barbadians by visitors is how hospitable and how warm Bajans can truly be once they get to know you. And this thing is just too basic. This thing is too basic. And as Minister of Finance, when we've done the numbers are within our capacity, because what I would have to spend to repair our brand, which, by the way, is still being damaged, and regrettably, it is being fueled by some of our own from within, but that has now become par for the course, particularly with the use of social media and technological tools that are not rooted in real news, but are rooted in fake news and personal agendas. I want to be able to say to you that for us to buy tickets for 400 persons to return to Barbados is not because we feel like being idle, but if a person has come here and they are staying in a 10 by 12 room or a 10 by 14 room, they have not been able to leave that room for 8 days, 9 days, 10 days, 6 days, but we're expecting to leave it within 2 to 3 days. The first thing we have is the inability for the person to be able to enjoy what they thought they were going to be able to enjoy. The second thing that we have is that they've never gotten to be in the country or see the country. And therefore, you would know that if a government is going to negotiate bulk rates for large numbers, it is not going to be the same thing that you are going to pay to as an individual to a tour operator or to an airline. But apart from anything else, if we were going to have to resolve this issue, ask yourself what it would cost the government of Barbados to buy electronic advertising on CNN, BBC, ABC, CBS, NBC. Ask yourself what it would cost us to buy half-page or whole-page ads from the New York Times to the Washington Post to the London Times to all of the major Toronto Sun, etc. Ask yourself, why is it that the Toronto Sun ran a story this week that the government of Barbados turned a positive out of a negative, or turned a negative into a positive, however which way you want to view it. And it is because we recognize that we may not always be able to control when something bad happens, either from a natural disaster or from our own actions. But what we can always control, my friends, is how we treat people. And we simply do not feel that a person should have to sue us, pay a lawyer in order to be able to do the right thing. But in any event, we also feel that it hurts our brand. And why is our brand important? Name me one family that does not have somebody involved in a job related to either tourism or the supply of goods to tourism. Last year, when we had no visitors coming, we saw how the reduction in the purchase of pork and chicken led to gluts and to those meats being frozen, kept in freezers, and farmers' production having literally to be stopped because there was nobody to buy the produce. Barbados, on average, hosts twice our population over the course of a year. It means that 600,000 people or 700,000 people who are long-stay people, and then another 800,000 that would normally be cruise ship day visitors, have to eat, have to travel, have to drink, have to do all of those things. And in the production of that, it means that it is not just the jobs that you see in hotels and villas, but it is the jobs at Bryden's, and it's the jobs at Massey, and it's the jobs at all of the distributive stores in town, because they're the ones selling produce or selling goods, and the farmers as well. And if they don't have goods to sell, then there are no truck drivers' jobs to carry the goods to the hotels. And if they don't have that, the plumbers and the other service people from AC right back through have no jobs. So I want us, please, and I want us as a nation, we are going to be 55 years as a nation this year. And we can have these conversations, but we have to understand the consequences of what we are saying and what we are doing. In the circumstances, my friends, therefore, to spend on or about $1 million to be able to deal with Barbados's brand and to deal with the damage that came as a result of what I would call a 1 in 100 event, because we've never had that kind of explosion where near 30,000 tests in just over an 8-10 day period has been literally foisted, or 20-something thousand tests, I should say, over an 8-10 day period has been foisted on us because of literally what would have transpired with the start of this event and with the prison. I want, therefore, to say that let us remember who we are. And let us remember how Bajans treat people. When people come to our house, the most popular thing, if you ensure you got enough food, what do? Hey, you, hold back. Family stand back. Family hold back. Some say FSB, some say FHB. Because that is who we are. And we accept that if you gives visitors an opportunity, literally, to be part and parcel of your environment, you have a responsibility to treat to them decently. And may I remind you, this is not just foreign visitors. These are our own people, our brothers and sisters, many of whom have been waiting in quarantine for a second test in order to be able to go to their parents' in some instances funerals, in some instances events, in some instances legal work. I have a multiplicity of complaints before us. And in all that I've tried to do since being Prime Minister of this country, I've always said principles only mean something when it is inconvenient to stand by them. And in this instance, the inconvenience comes in the fact that it will cost us. But equally, I think all of us have learned from this experience, and all of us will ensure that as we move forward with the rest of our lives, we literally be more careful what we do, but also recognize that consequences come with choices. When you make a choice, there's always a consequence. And regrettably, this activity has led to persons being disadvantaged, and we feel that Barbadians must stand up, and we do not need a lawsuit to tell us to do the right thing. I hope that this explains for you the rationale behind the government's position. I know that there may be some who still may not agree, but we believe that it is a defendable and accountable position, and that at the end of the day, it will cost us far less than us having to deal with severe damage in the marketplace to our brand. I spoke just now also of, regrettably, the level of fake news going around. And this is distracting, and it is difficult, particularly for those who are already working 18 and 20-hour days. And we saw the fake news attach itself indeed to one of our labor unions on Sunday, who then had to come out and deal with it. We saw up to yesterday, there was some foolish thing going around that the new chairman of the airport is now to become an executive chairman, and other persons are to be transferred. None of these things have any element of truth whatsoever. But we now have, regrettably, a set of people, a handful of people, who believe that just stirring and stirring and stirring is what the country needs, when it is the exact opposite. Barbadians want the temperature to come down and for us to get back to a level of normalcy as soon as possible. Those who believe that their elevation is rooted in anxiety and desperation being fostered and fueled among the population, I want to remind you that I disagree fundamentally. And over the course of 30 years in public life, I have seen locally, regionally, and internationally that nothing good has come from persons who seek to divide in the middle of a crisis or a war. And I say to Barbadians, stay focused. I'm telling you the same thing that I tell everyone else. And you know, there is a poem from Kipling that I keep carrying with me on my journey through life, that if you can keep your head when all others are losing yours, then you will be a man or indeed a woman, because it is at that point that you remain rooted and focused. And I'm not asking you to do anything that I am not prepared to do as a person. And I believe that one of the difficulties that we are going to face, in fact, I found it curious that over just a week ago, after we saw the difficulties take place in the United States of America, where even the social media took the unusual decision to ban a head of state, that we have others beginning to recognize that unfiltered news and fake news can totally destabilize a country or destabilize situations. That's why I asked you, we have put official communications in place. We have a health communications unit. We hear you in terms of the succinct need for reporting. They have heard you. We have also, however, to explain the rationale behind some of the things that we do, because we don't govern by proclamation. We govern with respect to being able to consult, to communicate, and to explain. And that's why we have an Administrative Justice Act that literally requires us not to be engaged in arbitrary behavior and arbitrary decisions. So that there are times like tonight when I have to be a little more expansive and to explain to you the rationale behind some of our decisions, because I can assure you we are not mad people, and we are doing things that are rooted first in science, but also rooted in principles and values and in the need to care for one another and to bring along the country as much as possible. It means that we also need to recognize that with this heightened level of activity over the course of the year, that there will be one or two things that may drop in between the cracks, not deliberately, but because as a small state, we have a limited number of people doing the same thing and juggling to be able to keep things together and policy positions together. And that is why we have the Caribbean community, because we believe that as a community of sovereign nations, small states, that there are things in which we can offer each other functional cooperation in order for us to be able to keep our heads above water, because we simply do not have the extensive depth of resources that other countries do. And why do I refer to that? The regional security system, RSS, is going to ensure, for example, that the shortfall that we have in rapid antigen tests between our supplies, that we work with each other and borrow from each other. And to that extent, if we need something that we've run short of, we borrow and give back to them. And if they need, they borrow and give back to us. And that is how we have been working. Early in the year, I had cause to thank the government of, last year, sorry. I keep forgetting that we're in a new year. Last year, I had cause to thank the government of Suriname and the government of Trinidad and Tobago and the government of Dominica. We continue to thank the government of Dominica and the government of Grenada, who have also been working with us as we have been working with them wherever possible. So, my friends, that brings me to the last point, and that is the issue of the vaccines and vaccinations. I don't propose to talk a lot about it tonight, because I think that this is going to require a far greater and deeper level of discussion and public education. I said at the outset that one of the things that we need to do is to ensure that to get back to a level of normalcy, we need to get to a level of herd immunity. And that's a global recognition of which Barbados is just playing its part in seeking to get to there. But we are concerned that there will be some people who are a little ambivalent or anxious, and over the course of the next few weeks, we will engage to be able to answer people's questions, not just in these formal processes, but also through public education that we will do in the different media and at the community levels in order to give people the comfort that they need to know. The last occasion on which we spoke, I told you that there might have been an opportunity for just a handful of us to be able to have a vaccination, and that there was much discussion even at my own level whether I would take it or not, largely because, not because I had any doubt about the vaccine, but I have a natural inclination to do FSB and FHB all the time. If you know me well, I will stand back and let others go forward. If you know me well, I will also roll up my sleeves and be at the front of the line going into the charge. I'm not asking anybody to do anything which I will not do. I'm happy to report that, therefore, in the course of the last few days, that there were 5 of our medical people at the front line who have taken the vaccination, the first dose, and myself, the Minister of Health, and the Attorney General also were the other 3 people who took it. My arm is a little sore, but other than that, I'm in good shape. You see me talking with you, and I am due to take the second dose in a few weeks' time, as are they. At the same time, Minister Walcott has been working feverishly for me to be able to access the other vaccinations. I think we've had meetings every day this week with different suppliers or different groups. But what pleased my heart perhaps more than anything else, when I was chairman of CARICOM last year, I would have indicated to the region that we had negotiated access to the African Medical Supplies Platform, which allowed us through our general rapprochement with our relationships with Africa to be able to look to see how we could work together in order to do procurement so that we could get the benefit of prices that a country like Nigeria with 250 million people could get, and us in Barbados with 300,000, or St. Kitts with 40,000 could equally be able to access those goods at the same price. Yesterday, as fate would have it, and the heads of government met on Tuesday, And I think you would have already seen the statement that we issued, which reflected the fact that accessing vaccinations for small states is really a question of almost trying to deal with market failure. The numbers that we will order are just simply too small to capture anybody's attention. And therefore, we have had to work with the COVAX facility, which you know, I've already spoken to you about that, and we expect that to give us the equivalent of 20% of our population. But we recognize that most of that is likely to be spread out over the course of the whole year, as the Minister of Health has told you. The initial disbursement is likely to be 3% of the population. But even without that, they have indicated to the Ministry of Foreign Affairs and the Ministry of Health that we may get an emergency amount for our frontline workers and for the most vulnerable by the end of January, early February, that will allow us to be able to start to bring down the temperature in the country. Without prejudice to that, I had also been working on separate avenues, and we continue to do so with the major companies that are involved. And the point that I was making about the African Medical Supplies Platform is that I received a call yesterday from the coordinator, who has in fact been requested by the President of South Africa, Cyril Ramaphosa, to lead a group of persons who were then deputed to go and meet with all of the companies manufacturing vaccines to be able to secure a set of purchases for the African continent going forward. BBC carried this story yesterday for those of you who want to go and see it, and you will see that they announced that they have secured for Africa 270 million doses from 3 companies in particular, from Pfizer, from AstraZeneca, and from Johnson & Johnson, but starting distribution from as early as March, but the majority of them in April going forward. The call that we received yesterday was that the Council of Heads of Government of Africa, who were presiding over this, believed that in this exercise they should carry along their brothers and sisters in the Caribbean community. And accordingly, I briefed the Secretary General of the Caribbean community last night, and we will have 2 weeks to determine whether we want to participate. The vaccines and the procurement opportunities will be put on the platform from Monday. And as I said, we are in a state of heightened negotiations across the board, not just with them, but with others, to see how we can literally be able to acquire enough to provide the herd immunity so some level of normalcy can come back to Barbados as soon as possible and to the region as soon as possible. I'm happy for that, because as we said, in this matter, a number of developed countries have already taken, and I don't blame them for it. I get it, I understand it. But in the absence of a public space that allows for equitable distribution, the difficulty with this virus, as Dr. Bess and Dr. Ford will tell you, is that if you don't allow for all to get it, you run the risk that it will continue literally to play with the global community and not to leave us in a way that we expect it to leave us. So my friends, these discussions are still very much alive. We're nowhere near finished them, but I felt that I need to share with you in order to bring you to a sense of calm with respect to what the future looks like and where we expect to be going over the next few months. Little did we know that 2 weeks would run as fast as it did. I remember speaking to you on All Year's Day there, and let me say, for those who are worried, the government is and has put a mechanism in place through the National Cultural Foundation to start to collect the data. For those who are upset that we didn't do it fast enough last week, I beg you do. Last week I had 2 bank holidays and we were full dealing with COVID. We're now on to it, so bear with us, and you're going to get through. We've said sunk costs. There's no sunk costs in alcohol. There's no sunk costs in a number of other things. But genuinely, this government will do right by everyone. And this notion of 2 Barbaduses is nonsense. And it hurts me from the point of view that, yes, we have a legacy of it, but this government has done all in its power to be able to empower and to uplift all Barbadians so that you know that everyone and each one matters. This is not a phrase that I used only in the Ministry of Education in 1995. This is a philosophy. This is an approach to life. And when you look at it, this is the government, for example, that chose to increase non-contributory pensions in circumstances where people said we couldn't do it. This is the government that put the Adopt a Family program in place that literally, separate from welfare grants, recognized that there were families who were not entitled to welfare, but who nevertheless had no money coming in, and hence the $600 a month was not intended to replace a salary, but intended to allow people to keep their heads above water. This is the same government that where persons did not pay NIS, that we had to create a mechanism to give them access to some cash too, and it was a lesser amount than they would have been entitled to under the National Insurance Scheme, and it had to come from central government because it could not come from the National Insurance Scheme because they had not contributed to it and would not be permitted to draw in from it. So my friends, let us not believe that because we are doing one thing here, that we're not helping somebody here. And the anxiety that attaches itself to every single thing, breathe. 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 Let us breathe. If we breathe as a country, if we breathe as a nation, if we breathe as individuals, I know, I am asking you, I know we're going to get through this. But I need everybody not to be titillated or not to be distracted by those who have other agendas. For those things that are real, like what we faced in this last week with the test, I accept the criticism and we take it and we offer our apologies where we've offered them, but we also seek to improve and ensure that we do not repeat the mistakes of the past. And we will take those criticisms when they come. But what we don't want is the profiting by persons on the sufferation and suffering of others. If we can agree to that and stay focused, my friends, I think we will go a long way. I want tonight, before I close, to continue obviously to thank the persons who are here, the frontline workers who continue to work every day. And let me say, on the matter of the payments of allowances, etc., those things were already in train. And if anybody who knows the government of Barbados, you can't wake up tonight and say somebody's going to get money and get it tomorrow. There's a process. And the process started in Parliament, and then the process goes through the various ministries and the Treasury, then to go to whoever it goes to. But I want to thank you all who are working on the front line, be it the medical personnel at the various institutions, be it the prison wardens, for example, that batch of persons who remained in the prison for 15 days straight and took their rest inside there while working shifts out, knowing full well that their colleagues literally were in the hotels waiting for test results to come back, and many of them now have been able to be released, while the ones who are inside the prison have now to go into quarantine and to have their 2 tests in order to be able to go back to their homes. We are conscious of the sacrifice which you are making, and I believe Minister Abrams met with many of you today, and I want, on behalf of the government, to thank you for your extraordinary sacrifice and efforts over the course of the last 2 weeks. We are beginning to see a level of normalcy. We are not yet there, but we are on our way towards it. So my friends, I also want to thank the police, the taxi drivers, the BDF officers, the persons working in the supermarkets, the persons who are working short hours but servicing the same number of people, largely because of the restricted quarantine. We get it. It is rough. But as I said just now, if we stay together, stay focused, and do what we're supposed to do, then we shall make it. And as I've said on many of these conversations, if we keep the Lord on our side and we do not allow doubts or fears to intrude into our head, then we shall make it. Look forward to seeing you again soon over the course of the next week or so, and let us continue to listen to the official news being disseminated by the government or on social media, largely because we do not want persons to have their stress levels or their anxiety taken up largely because of fake news. Bajans, we can do this. Thank you, and God bless us all.
Thank you very, very much, Prime Minister, for that extremely comprehensive discussion and presentation on where we are as a country and what our expectations should be as a people. And of course, for the call to go forward as a unified Barbados to try to beat back the COVID challenge, protect each other, and protect the Barbados brand. Prime Minister, thank you for your presence. Minister Bostic, Doctors Best and Ford, thank you all for your service to Barbados. Ladies and gentlemen, let us remember that, as the Prime Minister said, we are not yet out of the woods, even though we may be on the way there. But so we should continue to wear our masks, sanitize, wash our hands, and keep our physical distance. We've done it before. We know what we have to do. Let's keep doing it. Let's protect each other. Let us protect Barbados. Thank you so much, and good evening to you.